Hi friends, this is Dr. Sumana, Professor of Microbiology at JSS Medical College and Hospital, attached to JSS Academy of Higher Education and Research, Mysuru. And in today's session, I shall be discussing on the puzzles to pertinent use of antimicrobials in acute undifferentiated fever. This acute undifferentiated fever is discussed under the following headings. Definition of acute undifferentiated fever, because you need to know the definition to put it under AUF. Only then you will be able to rationally choose the antimicrobial agent. And then etiological agents causing this AUF with pointers for diagnosis. So it's important to diagnose appropriately because the rational choice of antibiotics depends on the etiological agents. And then we discuss on the empiric treatment and a few multiple choice questions, and then with a definitive treatment we're going to discuss under these headings to rationally choose the antimicrobial agents for acute undifferentiated fever. Now coming to the definition of acute undifferentiated fever, say any particular clinical scenario, if it has to get the tag as acute undifferentiated fever, they should fulfill the following criteria. These have been given the mnemonic Hales of I soda NVHCF. Now just to remember this mnemonic, it may be difficult. So I've connected these two mnemonics in the form of a sentence. Say, for friends congregating with hails of iced soda with alcoholic drinks, there's no value for honest cool friends. That means people who binge on alcohol, they don't care about the honest cool friends who are the teetotalers. So hails of ice soda and NVHCF. These two are the mnemonics. Now this hails of ice soda, what is it? So expanding this, we have all the negatives listed under this. The H is not hospitalized. A is not on antibiotics. I is no previous illness. LS is no localizing symptoms. IS is no immunosuppression. And OD is no organ dysfunction. And also the patient has not been put on antimalarials. Then expanding this NVHCF, NV is normal vitals. H is previously healthy patient. A patient from the community dwelling. And fever of more than 38.2 degrees Celsius and 101 degree Fahrenheit. So if any clinical scenario has to get this tag as acute undifferentiated fever, they should fulfill the following conditions. So this is the definition of acute undifferentiated fever. So now here I have a puzzle. So based on the above conditions, I have given various clinical features and you should categorize them into island and woodland. Island is representing the acute undifferentiated fever, and woodland represents features that don't fit into acute undifferentiated fever. So island should have features which support acute undifferentiated fever, and woodland should have features which do not support acute undifferentiated fever. So let me read out these features. Number 1, BP of 80/50. 2, hospitalized in the last 1 week. 3, no history of immunosuppression. 4, no organ dysfunction. Then 5, fever of 100 degree Fahrenheit. Then 6, given azithromycin in the last 1 week. 7, history of recurrent cystitis. 8, no history of previous illness. 9, no localizing symptoms. 10, signs of meningeal irritation present. And then 11, neutropenic patient. 12, history of diarrhea and vomiting. 13, a diabetic patient. 14 history of hurried breathing, 15 community dwelling adult, and 16 no previous history of antibiotic administered in the last 2 weeks, 17 history of decreased urinary output, 18 BP of 130 by 90, pulse rate of 90 per minute, and fever of 101 degree Fahrenheit, history of cough, then 22 headache and projectile vomiting. So all these features individually you analyze and put the features which support the acute undifferentiated fever definition into island and those which do not support into woodland. So here we have like this. So in the island we have these features. Number 3, no history of immunosuppression. 4, no organ dysfunction. 8, no history of previous illness. 9, no localizing symptoms. 15, community dwelling adult. 16, no previous history of antibiotic administered in the last 2 weeks. BP of 130 by 90. Pulse rate of 90 per minute. Fever of 101.5 degree Fahrenheit. Now the features which do not support the definitions or the criteria for acute undifferentiated fever, we have blood pressure of 80 by 50. So it's not a normal vital. So number 2, hospitalized in the last 1 week. Then fever of 100 degree Fahrenheit. Then given azithromycin in the last 1 week. History of recurrent cystitis. Signs of meningeal irritation. So these are suggestive of some localizing infections. And then 11 neutropenic patient, 12 history of diarrhea and vomiting, 13 diabetic patient, 14 history of hurried breathing, then 17 history of decreased urinary output, which is suggestive of renal impairment, then 21 history of cough, then 22 headache and projectile vomiting, which is suggestive of meningeal irritation. So these features do not fit into the definition of acute undifferentiated fever, while these features fit into the criteria of acute undifferentiated fever.
Friends, you can also go to this link and play the game online. Just like the seashore that I explained to you, you can play the game online and that will tell you whether you're right or wrong. Thank you. The causes of tropical fever can be explained with a mnemonic. I love red BMW. I is infectious mononucleosis. L is leptospirosis. R is rickettsial fever, E enteric fever, D dengue, B brucellosis, M malaria, and W is West Nile. These are the commonest causes of acute undifferentiated fever in the tropical region. Friends, I have another puzzle for you. I have already told you that I love red BMW is a mnemonic for the important causes of tropical fever. So amongst these, you please identify the important causes of tropical fever. We have a host of diseases from I, L, R, E, D, B, M, W. So here, impetigo, infectious arthritis, infectious mononucleosis, infective endocarditis. In L, you have Lyme's disease, leprosy, lockjaw, leptospirosis, lymphogranuloma venereum. In R, we have rabies, ringworm, rickettsial fever, and radiation. And then in E, you have enteric fever, eastern equine encephalitis, ehrlichiosis, encephalopathy. And in D, you have diphtheria, dengue, deep vein thrombosis. And in B, you have bacterial vaginosis, bubonic plague, and brucellosis. And M, we have MERS CoV, mumps, malaria, Marburg virus disease. Then in W, we have West Nile fever, whooping cough, wart, whipworm infestation, and wasp sting. So in this, you have to choose how many? 8 of them, which are the important causes of tropical fever. Fever is an important component of acute undifferentiated fever. Again, based on the types of fever, we try to differentiate the different causes of acute undifferentiated fever. For example, if it's an insidious onset low grade fever and then moving on to a high grade, which is called the step ladder type, is more characteristic of enteric fever. High grade fever, sudden in onset, which is intermittent, is more suggestive of malaria. And the biphasic fevers you usually see in dengue and leptospirosis. Now let us try to understand the different types of fever with the diagrams. So this is an intermittent fever. See, you have this fever spike on day 2, day 4, day 6. So every 48 hours there is a fever spike, and so this is called the intermittent fever, and which is very characteristic of malaria. But along with that, if the patient has severe chills and rigors, it's more suggestive of malaria. Next, we have the stepladder kind of fever. To start with, it's a low grade fever, and slowly it goes on increasing in its degree. So, this is a stepladder type of fever. It can go beyond 40 degree Celsius as well. So, this is typically seen in enteric fever. So, along with this, there are other features which are associated with enteric fever. So here there is an insidious onset of fever, and then there is severe headache and abdominal pain. Vague abdominal pain or more localized to the right iliac fossa, because the reticuloendothelial cells or the Peyer's patches present in the intestine get inflamed, and that's the reason they get a kind of vague abdominal pain. And because the more concentrated in the ileocecal junction, the pain is likely to be more in the right iliac fossa. So this is very characteristic of enteric fever. Now, what are the common features between enteric fever and malaria? Malaria, there is a sudden onset of fever, high degree of fever. In enteric fever, there is fever, but usually it's insidious in onset. The fever is a common phenomenon, and the other features are the severe headache and abdominal pain is more often seen in enteric fever, while chills and rigors are more often seen in malaria. Now we have the biphasic fever. So here the fever starts, goes to very high level. Within 3 days, it will just come down and touch the baseline for the 3 to 4 days. So the next 3 to 5 days, there may not be any fever, and then there is a rise in the temperature. So this is called a biphasic fever. So this is very typically seen with dengue. Along with that, there are other features. Especially here, this fever is described with different phases, like the phase of high fever, and then the critical period when the fever comes down, and then we have the recovery phase. So this is very characteristically seen in dengue patients. So initially the patient is severely dehydrated, and this is a critical period. They can go into shock and bleeding with organ impairment, and then the recovery phase is the reabsorption of the fluid, where all the parameters return back to the normal. Now, dengue, along with those characteristic features, we have other features like the retroorbital pain. The patient also may have severe headache and very characteristically back pain. This is also called as breakbone fever. And along with this, there may be some bleeding manifestations. So these are all some of the very typical features which will help you in the diagnosis of the etiological agent. Now this is also a biphasic fever. Here the fever lasts for 4 to 7 days, then comes down, and in the second phase there is a rise again. This is very characteristic of leptospirosis. So this is very characteristic of leptospirosis. Sudden onset of high fever, severe headache and pain in the calf and conjunctival suffusion. Along with this, the other features are like, there's a cough pain, and then conjunctival suffusion, severe headache, high degree of fever. All these things will be there. But the difference between dengue and leptospirosis is that there is leukopenia in dengue, while there is leukocytosis in leptospirosis. So with that we can differentiate. Now, friends, let us try to understand the different aches and pains along with the fever, and that may give you a clue for the diagnosis. See, let us try to decipher this diagram. There are three clinical conditions, and the common feature between the three clinical conditions is headache, and along with that, the other pains. Let us try to analyze. See, the clue is the first letter of the site of pain and the first letter of the disease are the same. So here we see pain in the leg. So L. L is leptospirosis, very characteristic there. And then here we have abdominal pain. We can also call it as enteral pain because it's the inflammation of the intestine that causes the pain in the abdomen. So enteral pain. So E is the starting letter and it is enteric fever. Now here it is the back pain. We can say dorsal pain. So D refers to dengue. So this is very characteristic. Severe back pain and all other muscle pain, and it's also called as breakbone fever. So the dorsal pain is more characteristic of dengue infection. So just try to differentiate between the biphasic fevers. We have dengue and leptospirosis. So the common features I have already described. The differentiating features, see in dengue you have leukopenia and leptospirosis is leukocytosis. And hemoglobin is normal or high in dengue, while in leptospirosis it is normal or low, and sometimes it can go below 7 grams per deciliter. Thank you for your attention, dear friends. If you're still puzzled, you can contact me at mnsumana12@gmail.com. This is just the part 1 of acute undifferentiated fever. In part 2, I'll be describing more of some more pointers to diagnosis and some diagnostic tests that we need to do along with the treatment options that will come in part 2. Thank you.